So I am the Executive Director for Maternal and Child Health Consortium. We refer as MCHC. And I've been with MCHC for 21 years now. In this role, I've been 9 years. So MCHC was created with the purpose of ensuring that women and children have access to healthcare. So we've been around since 1991. We serve families that live in Chester County. So we have different areas and staff members who are assigned by areas as well, going all the way from Southern Chester County to Phoenixville, Pottstown, Coatesville. And also we serve a little bit of a few zip codes from Montgomery County as well. We ensure that they have access to healthcare, like prenatal care. They are enrolled in the WIC program. They have health insurance or access to healthcare even if they're not eligible to apply for benefits, but then during pregnancy, that they have the services and treatment that they need to deliver a healthy baby. Once the baby is born, then we have parent educators providing home visiting services, mainly working with the mom, with the baby, and everyone within the family.
So I'm Ronnie. I'm a development associate at MCHC. I do a lot of the behind the scenes work in terms of getting our back to school supply drives together, our winter coat drives, those kinds of things that I think relate to our mission in the sense of looking at caregivers and children from like kind of a holistic approach in a way. So it's not just, making sure that caregivers can take care of their children, but also what other kind of needs can we meet in the process. And then I also work with kind of all things outreach. So making sure that we're at as many events as possible anywhere really in Chester County, whether it's kind of churches, community fairs. Coatesville First Friday is a big one for us throughout summer, things like that.
So I am Sophia Soto. I am a parent educator for the Empowering Families program, which is one of our home visiting programs at MCHC. At my time in Coatesville, there was a family that had come to our office and they needed assistance, and I was able to connect them with resources. I think that's the beautiful part about MCHC is that we network with so many other organizations that we're able to connect with resources that maybe we can't provide direct resources, but we can refer out to resources. And in that instance, it was that we were able to connect them with services and resources that they had not known. And so the beautiful part was that a year later, I was actually at an outreach event, and the family recognized me, and they came up to me, and she just started crying. This mom, and I'm like, oh, like hello, not even realizing who I was saying hi to, and that's when she told me a year ago you helped us, and like where our family's at now is just we're here because of you. We're at the point we are because of you, and that just kind of reminded me why I do what I do and why I'm here at MCHC.
And the grant has actually provided us the opportunity to do doula model. We are implementing the doula services to making sure pregnant moms have access to healthcare, everything that is happening with the local hospitals, the closings. Myself, I've been part of throughout the last years, part of the whole assessment and initiative and response that we need to do in order to support the families in terms of the closing of the hospitals. So Aunt Sophie is actually getting certified in September, right? So we need to work in collaboration with other organizations, community, local businesses, because we, not all organizations, we cannot do it all.
My name is Keith Barres. I'm with Family Service of Chester County. I'm the program director of one of the programs of Family Service, which is called Project One. Project One does HIV case management for anyone in Chester County. We cover the whole county, but our main office is here in Coatesville. We have clients in Phoenixville and Oxford, Kennett, all throughout the county. We have currently about, I think, 112 folks that we case manage and that are active with us. And that the case management covers things like making sure that they are hooked up with a doctor, making sure that they have insurance, understand what the medications are. We always talk about prevention, and we talk about nutrition, because that's also important. Part of the Project One umbrella is we have a housing program also, similar to Section 8, where folks with HIV can get subsidized housing. In Chester County, the highest rates of infection with sexually transmitted diseases have been in the African American community, and in this area, around the coastal area. So as much as we would try to do little bits of things around prevention, it wasn't any formal program. There was no consistency to it in any sort of prevention health programs. What the Alliance has allowed us to do is to begin that process. And now we have something that, again, excites me, because I would much rather prevent something than for someone to get any disease. And basically right now what we're doing is we have unlimited supply of condoms. So we bring those in as the barbers need them. We have information around all the STDs that are out there. You know, we have folks who are able to go to school and now get jobs, support them getting on that path. We have folks that are working who may have not had a job in years, and trying to make sure that they are able to kind of switch that back on, getting up in the morning, making sure you have your bus fare, whatever, all those sorts of things. We had a client that we newly diagnosed, a woman who was in the hospital at Chester County Hospital, was able to leave the hospital and to get her HIV under control, so she was healthier. She went through chemo and beat cancer. She decided that she wanted to go to school and be a nurse, because she wanted to give back. We supported her a little bit with school, but she did a lot of that work on her own. She graduated, got her RN. A couple years later, she is now a nurse. One of the major issues with HIV still is stigma. People feel that they can't disclose to friends or family about their status because of the repercussions. So many of our clients will stay in care just because we have that connection. They have a community that they can feel safe talking to.
Mitzvah Circle has more families than ever requesting our help during this grant period. This is why the funding has been so important, because we don't want to turn people who really need help away. We want to be able to get them basic needs so they can go to school, go to work, go to medical appointments, maintain their health and well-being mentally and physically, and CDCL has helped us do that. Yesterday I talked to Christina. She is a social worker who was just let go from her job due to a lack of federal funding, and she's now a recipient of Mitzvah Circle. Your help allowed us to help Christina, so thank you for that. She has 2 children and has been a social worker for 17 years. And this is just a tough climate, and I think those stories of people who are working, who are in the community, who are caring, loving people, is really what it's all about, and those are the people we want to uplift and help them move forward.